Last week we had some genuine success with this Primal Reflex Release techniques. Now I'm back to see John, and hopefully we can use the same assessment and treatment on my troublesome shoulder that I've had for a very, very long time. If he can fix this, I'll be very surprised and also very grateful. So let's go see what he has to say.
Nick's got some nagging left shoulder issues that always seem to show up when he plays tennis, specifically from the serve. So what we're going to do is we're going to take a look and see in the range of motion where Nick is having an issue. Okay, just come straight up for me, as far up as you can go. And right about there seems to be that stuck spot. You feel that?
Yeah,
okay, you're going to come straight down. You're going to come this way. Now I want you to have it go straight back for me as far as you can go. Then what I'm going to have him do, come straight out to the side for me, come out this way. And then we're going to come up here. I'm going to have you stay in that position right there and go straight back that way. And we're going to have you come this way, and as he crosses over here, the scapula immediately starts to ride up, so we know that we're not dealing with a shoulder that is agreeing with what we call scapulohumeral rhythm. These two bones right here have to get along, okay? And in Nick's case, this one is kind of wants to lock down, this one seems to want to do all the work. So we're going to see if we can use PRRT right now to help Nick and maybe open up some of the pathways in his brain to allow those movements to happen. So if we're in a situation where the brain is on a certain spot, okay, and forcing that spot from a reflex perspective to be out of position, what we want to do is get the brain's attention, give it a stimulus, if you will, and then have the brain register that, say, no threat, and then relax it. Once it relaxes it, it breaks that connection, right? So all we're trying to do with all this stuff is break these reflex connections that the brain has that's forcing the body to move into a position that is going to be inherently not good for you, okay? So again, my culprits in my mind, my probable suspects, if you will, are going to be some of the muscles that cross this area right here. So one of the techniques I use with PRRT is I take the scapula and I just kind of reflexively, it's called, pull, which means very quickly, and let the brain kind of come into that area, determine what's going on, notice there's no threat, and then immediately begin to start releasing. I also want to take a look at his sternum and see if it's moving properly. So if I take the right side of his sternum, I can see that moves pretty good. The left side, you'll notice, gets stuck right about there. Can you feel that? Right? So one of the things we do for that is I have him take his arm across his body this way. I'm going to have you pull in this direction for me, but I don't want you to let up at all, okay? You're going to pull and I'm going to resist you. So we're going to do that same range of motion test we just did before. So go ahead and take that arm straight up in front of you. How's that feel now?
Yeah, it feels fine.
Much better, right?
Feels good.
Okay, come straight down and come out to the side for me. Let's see how that feels. Yeah, you can see the scapula moving much better now. This whole area right in here, these two bones are getting along pretty well. Okay, no problem with that. Now I'm going to have you go straight back for me this way. You're going to open that up. Yep, notice you get a nice little stretch through here now. These muscles now don't feel like they're guarding anymore. We're going to come straight over in the other direction now and just open that up. Okay, no pain with that? Okay, that's great.
As demonstrated, my shoulder is moving so much better and there's no pain associated with that movement at all like there was at the start of this segment. Thanks to John, and I can tell you right now, Primal Reflex Release Techniques is certainly a viable option when dealing with pain, so don't forget to ask your doctor about it. Remember to connect with us. I'm Nick Davey for KTV.